Hi everyone, this is Alex Pyrrha. I just wanted to take a minute and say I hope you are all staying safe and keeping your families happy and healthy during such an unprecedented time. Obviously, this novel coronavirus has changed all of our lives in a matter of just a couple of weeks, and we all say the new normal as if that's something that we're used to, but really every aspect of our lives has been changed. I know for me, I've done a lot of thinking about my own family, and with my dad's 8-year battle with stage 4 colorectal cancer that ended last summer, I've thought a lot about what he would think and how he would feel going through such a scary and overwhelming time for those of us who are healthy, let alone someone who was undergoing 8 years of cancer treatment. So that kind of spurred this thought in my head: what if I could talk to his oncologist about what cancer patients are going through, what anxiety and fear they may have? So he went to a place called Virginia Cancer Specialists. I talked to his oncologist, Dr. Alex Pyrrha, who's been a part of our family for almost a decade now. So that conversation happened just a couple days ago. For those of you who don't know, Dr. Alex Pyrrha works at the Virginia Cancer Specialists. He actually treated my dad. He was my dad's oncologist for 8 years. So we love you. You've been a part of our family now for almost a decade. We love you even though you're a Mets fan. Thank you for doing this. I want to have a conversation with you based on the coronavirus pandemic and how to best support cancer patients as well as families who have a loved one battling cancer. And I want to start off by asking you, what have your patients told you about maybe their fears or anxiety when it comes to this pandemic?
Sure. So our patients have been incredibly stressed, obviously, to begin with a cancer diagnosis. And this just makes everything a lot harder. Right? I mean, most people will be fine. The challenge is a couple of things. One is everybody's worried about getting COVID-19 infection and ending up in the hospital. And that's obviously a very real risk and a real concern. Still, most people will be fine, but nevertheless, that's the biggest thing. The other thing I think is just loneliness. I mean, people can't go anywhere. So what do you have to do if you have a diagnosis of cancer? You can't really distract yourselves other than watching TV all the time. So I think a lot of people are just struggling with that, staying at home, thinking about things, and that makes it harder. So it makes it a lot harder. It's also the unknown, right? I mean, it's hard enough to have cancer and have an unknown, but when are people going to be able to go to the market, go to school, jobs, money? These are all huge worries for a lot of people. So it's tough. It takes a stressful situation and clearly makes it harder.
I think when you talk to a cancer patient, they really cling to the things that they're still able to do. If they are able to go to a kid's baseball game or something like that, they want to make sure they're able to still have some sense of normalcy. And now no one has normalcy. So in that sense, does this really kind of like a double-edged sword affect mental health, in the sense that to stay safe, you can't do anything as a normal person. And then when you have this diagnosis, you have to be even more careful.
Yeah, there's no distractions, right? There's no, like, as you said, going to your sons or grandsons or somebody's baseball game, or going out to a concert when you're feeling good, or just going out to dinner, right? I mean, all those things that you kind of do to pass the time and you look forward to when you're doing well with your treatments is very hard. There's also the stress of, I had a patient call me on call last night. They refused to go to the ER for fear of getting COVID-19. She clearly needed to go, but she was in tears about having to go. I'm like, yeah, you have no choice. So yeah, it's tough.
I think I know from personal experience with my dad, he had pneumonia, we believe twice in the last 6 months. And again, not really sure how he picked it up. Probably a common cold, I think, is what most people were telling us. But there was so much fear every single time flu season would come up, or, it'd start getting colder and a chill in the air. A lot of these patients, they can't just stay home. They have to come outside. They have to go to the ER if they're having an emergency. They have to come for treatments. Can you speak to how dangerous this virus is, considering how contagious it is for a healthy person, let alone if you do have some compromised immune system?
Well, clearly it's obviously dangerous, right? I mean, clearly people are getting sick and dying to this. That being said, for most people with common precautions, I mean, most people are fine. With social distancing and all these Zoom calls that we're all having right now, it's clearly made a big difference. So yes, it's a huge concern, but still, as of right now, it appears most people will be fine. I mean, it still hasn't affected, but a very, very small percentage of the population. Part of that is because we've done the right thing. Part of it is because still most people will be fine in the current situation again. But we'll obviously have to, see and continue to prevent it from spreading by doing everything that we're doing right now.
You mentioned that you're advising your patients, really stay home, take that seriously, don't mess around with that. But is there other pieces of advice you're giving them as they navigate the stay-at-home orders, or even when the country begins to reopen again, what kind of advice are you going to give your patients, with the information that we have right now?
So it's interesting. I think the advice we're going to give is the same advice we've always probably should have been giving, which is stay away from sick people, right? Don't go places you don't have to go. Purell is your friend. I tell people that all the time. Before all your friends and family come over, they're having a fever, tell them not to come over. If they're not feeling well, tell them not to come over. We know that there are obviously carriers that are asymptomatic, and that's obviously the big concern. And there's only so much you can do in life, right? Once the world hopefully returns to normal, we're all going to want to be doing that. But the common sense things, I think we just have to emphasize very well. And what's really hard is, grandparents wanting to see their grandkids, and you know how snotty grandkids are, colds and runny nose, and they always want to see them. So that will be one of the big things that we see.
Is there things that, like I know when my dad was battling cancer, we were getting flu shots, or we were, taking extra precautions to make sure the family was healthy so that we didn't accidentally bring something back home. What should families be doing? Not just, staying healthy or things like that, but are there ways that they can support maybe the mental health and also the physical health of a cancer patient that they maybe live with?
The physical health is always tough because it's just by, staying clean, washing yourself, trying not to get sick, and avoiding others when they're getting sick. Mental health is the real challenge, and that's Zoom calls and phone calls and doing those little things in life, especially, when you can't see your friends and family. Patients undergoing chemotherapy, they have good days, they have bad days. During the bad days, some people lock up, some people just want to talk to people, and now we're doing it by video camera. So it's harder, and you have to remember to actually do that instead of going to see your neighbor. So reminding people that's important to do.
Obviously, you can't halt cancer treatment for some of your patients. How has the practice been impacted in the sense of bringing people in? I mean, is it nerve-wracking for you guys as well to have these patients have to come to you?
Yeah, we're not frontline people, right? We're not in the ERs, we're not doing those things, but we see a ton of people. So how do you minimize, do the social distancing to do that? We're wearing masks. So obviously, it's kind of hard to look at people during masks, especially when you're seeing smiles and tears. It actually is a little bit more challenging. We're using Zoom. We're using some other new programs to do it remotely as well. And it's working for the most part, but it is a little very different environment. It will be interesting to see how much of this, most people are probably aware there's a lot of telemedicine going around, how much of this actually sticks after all this. It may really result in a big switch where we realize, God, instead of making our patients come an hour to the office, sit in traffic and park for a 5-minute visit or a 10-minute visit, can we do a lot of this remotely and make everybody's lives easier? And I think that's really going to happen afterwards. So maybe there'll be some positives.
I was saying maybe there's a renaissance that we'll experience where more people are working from home a couple days a week, and you're seeing the pollution, decrease in a lot of different
Wouldn't
cities.
there be great if there was something positive out of all this?
Let's take it. I want to ask you one more question. I know my mom's part of the effort to kind of make thousands of masks at this point. What has the response been like from your patients, from the families, from this extended Virginia Cancer Specialist community in supporting your mission and making sure, everyone stays healthy there?
Well, so first comment is, and I'm going to drive a lot of other patients crazy, your mom is probably one of my all-time favorite patients' wives, and I love her dearly, and I don't want to make you cry, but and I think, there's a great video on one of the local news stations here that I just saw, just so you know, and she's awesome. But it's been great to see, right? This brings out the best in people and it brings out the worst in people. So, seeing people like, your mom is part of an effort to make masks. I think we have like 3,000 masks right now, which is awesome, right? We'll use a lot of them. We will continue to use them. We'll save them. Hopefully we have so many and they'll sit around for something, but it's nice to see. And it's those little things in life that you kind of forget that make everybody feel like they're part of a community, which is often we forget, right? We get involved in the daily lives, you do your thing, and that's not until something like this that you realize that there's a lot of good people out there.
Is there one takeaway message you want anyone battling cancer or a family member or caretaker to know from you about navigating this time? Just
do the best you can, roll with it, right? We have patients upset because we have to cancel appointments, we have to move things, staff members as well. Just roll with it, right? What are you going to do? None of us pictured this even a month ago, right? This has just been going on since early March. So working it day by day and just be prepared for change. And
Thank you so much for doing this. I really appreciate it. Obviously, there's a lot of resources out there for how to keep ourselves safe and healthy, but I hope this conversation gave you a little bit more perspective about how to keep those with compromised immune systems safe and healthy during this COVID-19 pandemic. That's all I have. Be sure to like and subscribe on this video for more information about how families undergoing cancer treatments handle things like these and handle mental health issues. But for now, that's all I've got. Thanks for watching.